Hello there, good evening everyone. Thank you all for coming to the online session. Can I just ask if everybody can hear my voice clearly?
Yes.
Okay.
Yes, it's okay.
Excellent.
Yes, Dr. It's clear.
Excellent. So we're going to do some ground rules before we start. I would appreciate if everyone can put their Zoom on mute. The reason being, because I am expecting a lot of participants to join in shortly. If somebody has any questions, we will obviously give them time to come and comment, and then they can unmute as well. So that will be useful for the house rules management. Okay, excellent. So first of all, thank you everyone, because everyone who's here, they mean that they are quite keen on learning on the OSCE stations and the tricks about how to pass OSCE. Now remember, it's not a difficult exam. The reason it becomes a difficult exam is just because we don't know what we're dealing with. Once we know the rules of the game, the rules of the OSCE, then it becomes easier to play to win this. Okay. So right. So just a bit of introduction. So my name is Dr. Mashhood. I'm one of the emergency medicine consultants. I graduated from Pakistan, then I spent 12 years working in UK. I've done specialist training in emergency medicine in UK. Did my MRCEM in 2013, then did my FRCEM in 2016. I've also done my MPH, Masters of Public Health, and Diploma in Public Health. I was the teaching lead in the London hospital where I was last working. I was also a teaching lead in the Al Ain hospital in UAE where I was working last year. Currently, I'm working in Tawam, which is a tertiary hospital in Al Ain, which is Abu Dhabi, Emirates of Abu Dhabi, and I'm part of the faculty over there. So I have a keen interest on passing on the knowledge for OSCEs to candidates. The reason I wanted to do it free of charge is when I looked around, there are a lot of OSCE training courses all around the world. Most of them happen in Dubai, London, Saudi Arabia, but most of them are charging a lot of fees. There's nothing wrong with asking for candidates to pay them a good fees if they're providing a good service, but some of the fees, I think, it's quite a lot. One of the courses I looked at was asking $800. The other one is asking for $1,500. What we do forget is when the candidate is at the level of trying to pass an OSCE exam, they have other commitments as well. Anyways, so that was a basic background why we wanted to do this. So we're going to do a very time-specific schedule. The first half an hour, which is right now, we're going to talk about what is OSCE, how do we prepare for OSCE exams, and do we need to respect the OSCE exam, and what is actually an OSCE exam constitutes. The reason I want to discuss this right now at the start is once you know the importance of OSCE and the importance of basics in OSCE, then it becomes really easy to apply those basics in the rest of the OSCE exams. Okay. So the reason we have an OSCE, so the OSCE essentially is a practical exams, as we all know. So once you are at the level of the OSCE, whether you are doing a PLAP OSCE or an MRCEM OSCE or an FRCEM OSCE, that essentially means that the examiners have already judged your background knowledge by their written exams, right? So what they're not keen on is judging again your clinical knowledge, because that's been done previously. What they're more focused upon is finding out whether you are a safe physician, whether you can practice safe medicine, whether you are compassionate towards your patient, whether you can communicate clearly with your patient. And if you can do all of these things, then there's no reason why you shouldn't pass an OSCE exam. The main reason why candidates fail OSCE exam is, first thing, they're underprepared. They're underprepared to attempt the OSCE exam. They're not underprepared from the clinical knowledge because they have already been tested, but they are underprepared as how to tackle the OSCE examinations. So there are certain keys which are quite basics. Right. When you go to an OSCE exam, prior to the OSCE exam, 48 hours prior to the OSCE exams, you need to stop stressing about the exams. The last 48 hours before your exam should be the most peaceful time, because you need to be mentally relaxed before your exam. All the hard work should be done prior to 48 hours. And mind you, it involves a lot of hard work to pass an OSCE exams. That comes to the point you have to respect this exam. Once you start respecting this exam, why do you have to respect the exam? The reason you have to respect this exam is once a candidate clears the OSCE, either at a PLAP level, if they clear an OSCE at a PLAP level, they get a license to practice in UK. If they clear an OSCE at an MRCEM level, they automatically transition from a junior doctor to a senior doctor, either become a specialist or a senior registrar. And more so important, if a candidate passes an FRChem OSCE, most likely they are transitioned into a consultant position. So in all likelihood, is a very important exam in any candidate's lifetime. It was certainly true in my case. The PLAP exam was extremely important for me. MRChem was extremely important, and FRChem literally changed my life for good. So hence, you have to respect the exam. Okay, so what things we need to do for OSCE exam? The main take-home message, which we're going to drill on today, is communication, communication, and communication. You have to be really good in your communication skills. Because in all the OSCE stations, the one thing that stands out is how a candidate communicates with the patient in front of them, or how do they communicate their plan of action, their differential diagnosis. So you need to be a good communicator. Now, communication itself is a very broad field, but what I would try to do is narrow it down to a few basic things. Remember, if you're focusing on PLAP exam, MRChem, and FRChem, you need to understand that these are exams which are based for the British culture. The examiners who sit on these exams work in the British culture. The patients or the actors who come for the exam are probably from British background. So for them, the British culture becomes really important. So what is a British culture? If you narrow it down to simple words, British culture, you have to be really polite towards your patient. As a physician, you need to be extremely polite. You need to be speaking to them in very clear, simple English language words. You don't have to be a British-born English first. Your language it's not necessary that your language should be English. First language should be English. If you can communicate clearly, simply in English language, it's more than enough to pass the OSCE exam. But in the exams, in the OSCEs, you need to be polite, you need to be clear, you need to have a clear thought process in your mind before you go into an OSCE scenario. You need to read carefully what the scenario is asking you for. I've seen a lot of candidates. I've myself made a lot of mistakes because in the pressure of the OSCE exams, the last thing you want to do is waste your time reading the presentation outside the station. But if you spend 15-20 extra seconds on reading that information and absorbing the information, what they're asking you to do, then you would be mentally prepared in a better way to go and tackle the station, right? So you have to look at all the information which is relayed there. Spend your time, spend your 1 minute, read it for 30 seconds, absorb for the next 10 seconds, and then for the last 20 seconds, you have to make a plan. What do I need to do? What is the station asking me to do? What is the key point in the station which I need to elicit? What is the underlying diagnosis or the thing that the examiner wants me to crack? And what are the things which I cannot miss in this station? So I hope that is clear, that spending a few extra seconds outside your station reading to this scenario makes a hell of a lot of a difference. Most of the candidates, when they go in, they have read the station, but they have not grasped the information. They go in, then they start asking the examiner, can I have a listen, can I look at the station again? So that gives you a very bad impression to the examiner. All right, so that's the first point. Second point, now these OSCE stations are back to back. One station after it finishes, then you go on to the next station, then you go on to the next station. You will have one or two stations break in the middle, but most of them, they're one after the other, consecutive stations. So whatever happened in your last station has to remain in that station. You have to let go of that, whatever has happened. If something really bad has happened, for example, you have given the wrong diagnosis, you have given the wrong plan, and you've just realized you've given the wrong plan, and you haven't answered the patient's concerns, but you have to remember that's happened now, that's happened in the past. You cannot carry on that thought process, whatever's happened, into the next station. Because what will happen if you carry on that thought process into the next station? It's simple. You're going to get confused. You're not going to have a clear thought process for the next station. So, second take-home message. Whatever happened in the last station, you just have to forget it and move on. Start fresh for the next station. What you want to do is win that station, the next station, even if you have lost that last station. Okay? So that's the second point. Now, very simple things. Before the day of the exam, before 48 hours, you have to have, last 48 hours before the exam, you should be in the relaxed state of mind. That is not the time to go and grab your books. That is exactly not the time when you spend 18 hours out of 24 hours practicing. Everything, the practice, reading your books, practicing with your companion or your colleague, attending sessions should be done before 1 month, 2 months. Okay, last 48 hours is your time to give your mind some piece of rest. Okay, and you need to have a good sleep for the last 48 hours before the exam. And you need to look after your diet. Remember, OSCE exam lasts anywhere between 2.5 to 3 hours, right? And those 3 hours are really exhausting, not physically. Physically, some people might be, for some candidates, it might be exhausting, but it's the mental game out here. In the OSCE, it's just a mental game. So your mind needs to be fresh. You need to have a full sleep before you go in. So that's the third point. You need to look after yourself just before the OSCE exam. Right, 3 points. Right. Fourth point, and that's the important point. I've never seen a candidate, I repeat again, I've never seen a candidate pass an OSCE exam without hard work. Hard work works. Working really hard is what successful people do. Working really hard is what successful candidates do. You have to work hard. Now, it's one thing working hard, but it's other thing working hard on the right things. If you work really hard for the last 2 months before the OSCE exam, but you haven't focused on the human factors, you haven't focused on your communication skills, you haven't focused on your politeness, you haven't focused on your clear word communications, and then at the last week somebody comes and observes you and say, hang on a minute, you should be doing this way. Hang on a minute, you should be doing this way. That's not the hard work. I mean, you need to work hard, but you need to know what you're working hard on. That's where communication skills holds the key. Right. On the day of the exam, you need to focus on your breakfast. That is the last day. What you want to do is rush off for the exam and not have your breakfast. Because then the next 3 hours of your OSCE, you've lost the match, okay? You need to prepare yourself. You have to eat enough carbohydrates in your breakfast. Day of your OSCE exam, you should treat yourself with a very good breakfast. You should enjoy. You should give half an hour for your breakfast. Some people, whatever they like, they should just make an effort, or get your friends or family to make an effort for your breakfast. You need to have a high-calorie diet which can sustain you for the last 3 hours. If you are a coffee drinker, drink coffee as much as you can, or as you normally do. Some people prefer tea, but that's absolutely fine. But what you don't want to do is load yourself in energy drinks, because that will drain out later on. Anyways, that was just a simple chit-chat. Okay, right. Coming back to the main thing, communication, right? Right. So let me just tell you, let me just ask, let me not ask, because we have approximately 75 participants, so I can't keep on asking one. Okay, I'll ask and I'll answer myself. Right, the OSCE stations. How many OSCE stations are there? Let me just see if I can. All right, okay. So right, so let's say how many OSCE stations are there. Just 1 second. Right. So they are anywhere between 16 to 18 stations. Okay? So there's 16 to 18 stations. Out of those 16 to 18 stations, okay, you will have at least 4 to 5 history-taking stations, okay? Okay. One has to be a breaking bad news station, okay? One has to be a psychiatry station. 2 to 3 will be resuscitation stations. Okay, so 5, 6, 7, 8, 9, 10. All right, so around 2 would be examination stations, and 1 or 2 would be difficult consultation or referral. Okay, so this is your normal OSCE, right? So if you just focus on there, about 4 or 5 history-taking stations, along with breaking bad news station, psych station. I count them as communication stations, right? So 5, 6, 7, and difficult consultation. Approximately 8 to 9 stations are purely communication skills stations. I repeat again, out of this 16, approximately 16 stations, 8 or 9 are pure communication stations. Once you crack your communication stations, once you know how to deal with a communication station, you have cracked the OSCE exam. Candidates who cannot understand what they are expected to do in the communication stations are the one which struggle to pass the OSCE. I hope everybody passes the OSCE, but this is what you're faced with. You're faced with an exam which will give you at least 8 to 9 communication stations, and imagine a candidate is not comfortable with the communication skills, or they're not sure how to deal with, how to act on the communication skills. I wouldn't expect that candidate to do very well compared to a candidate who knows exactly what they're expected to do in communication skills. They know exactly how to act on the communication skills, how to talk, how to behave, how to sit, how to do non-verbal gestures in the communication stations, how to ask the right questions, how to know the time management, because you're going to get at least 5 to 7 minutes where you have to polish off your station, including discussing the differential diagnosis, discussing the management plan with the patient. So 5 to 6 minutes you have to be done with this. So time management, a big key in the OSCE scenarios, okay? So you know exactly what I'm talking about. 8 to 9 stations, you have to be really good, okay? Right. So we've talked about how, what the OSCE constitutes, right? We've talked about why you have to focus on the OSCE exam, because this is a life-changing exam, right? Whether you are doing it for PLAT purposes, MRCEM and FRCEM. Mind you, the only difference between the PLAT, MRCEM and FRCEM OSCE is the slight increase in intensity. Otherwise, if you compare all these three exams, all three OSCE for these three exams, the template or the pattern of the exam is all the same. They're all focusing on finding out whether you are a safe doctor, whether you are a good communicator, whether you can do time management, whether you can make a patient comfortable or not. Right. What we're going to do is, once we just a bit of a house rule, we have to break up at 5:40 UAE time, because the Zoom session will finish around about 40 minutes, and then I'll give a 10 minutes break, and I'll come back, and when I come back I will have a candidate with me. I will be the candidate, I will have a patient with me. I will first demonstrate to you what we expect in the exam, what you guys should do just before the exam, what level you guys needs to be at during your communication OSCE. So we're going to focus on two important OSCEs today, which I think are the basics of passing any OSCE exam, whether it's for PLAT, MRCEM and FRCEM. First of all, we're going to do a breaking bad news OSCE. I've never seen an exam up till now. I'm sure there will be exam. I've never seen an exam up till now in which a breaking bad news OSCE hasn't come. I'm sure there will be, but it's never come across my mind. And I've been there, I've been involved in teaching for a very long time, right? So breaking bad news is essential. You need to know how to break bad news in the British UK NHS setup. It's not about the NHS setup, you just have to know how to break a bad news in your clinical practice. I know I've got candidates today, we've got approximately 80 candidates, which is quite overwhelming, because I was expecting, when I launched this, I was expecting 5 to 10 candidates to just come up. I've got 80 now, and then I had more than 400 forms I had to prioritize. Anyways, so that's admin staff to deal with this. Right. So, breaking bad news. It's not just about the NHS that you need to know how to break a bad news. It's about your own clinical practice. I know candidates who are in South Africa who have joined. I know candidates who are in Gulf, Saudi Arabia, Qatar, UAE, Kuwait, they've joined in. I know candidates who are from UK who have joined in, from Pakistan, India, Malaysia, Sri Lanka, Myanmar, Guyana. Anywhere you practice, the basics of breaking bad news will still the same. And remember, it looks difficult from the onset. When I will do it, it might just look too much for you to do it. But with practice, you guys will reach there. There's just certain rules, certain steps you need to follow for any station. So we're going to do one breaking bad news today, which I will do for 5 to 10 minutes. Then we're going to do a debrief. I will explain to you step by step what I have done in breaking bad news, and then I will open it up for questions. Then each of you can ask questions. Carry on. And in the last session of the day, we will do one more communication skill, which I think is essential, which will be a history-taking communication skill scenario. Now, the presentation will be a very straightforward one, but regardless of the presentation, it's the template you need to focus on. It's the methodology, it's the way, the human factors, the non-verbal factors, the communication, the clear word communication, the satisfaction of the patient, asking the concerns of the patient, addressing those concerns will be the key. It could be any history station. It could be chest pain, abdominal pain, headache, hematuria, urinary frequency, nausea, vomiting, anything, any complaint you can think of, you can fit into that template, and then you can apply that template in any of the history sessions. So this is what we're going to focus on in the last part of this session today. But right now it's just an introduction. It's about what is OSCE. Okay. Now what I'm going to do is I'm just going to ask you guys if anyone has any questions just about the basics of OSCE. What are you expected to do in OSCE, and what the OSCE constitutes. If anyone has any questions, please unmute yourself and just ask questions. If not, then we're going to carry on.
Hi, Dr. Mashhood. It's Dr. Sana here.
Yes, Dr. Sana.
Yes, I was wondering if you could give us permission to record this session on our computers, so we can refer to it later on as well.
Yeah, that's a very good question, Dr. Sana. I should have done this initially on the housekeeping rules, but I forgot. Thank you for reminding me. Now, feel free to record this session. I'm not charging anything. I don't believe in charging my fellow colleagues for giving on education purposes. So feel free to download it on your computer and review it again and again. I think that would be a good idea. But remember, rather than focusing on downloading, I will be uploading these on the YouTube with the channel I've made for you guys, where I time to time put on my videos. So I will be putting on the YouTube, but if you want to still download, by all means, please download. Okay? Any other questions?
Dr. Mashhood.
Yes.
Yes, please. Just having one question is that what is the expectation in the MRCEM OSCE and the FRCEM OSCE? Is there any difference between both of them, and what is the expectation?
Excellent. Thank you very much. Can we just unmute everyone? I'm just going to answer this question. After this question, after I've answered, you can unmute and ask whatever. Okay. Now, excellent question again. MRCEM and FRCEM, right? Again, a very good question. Now, the basics of the OSCE are the same. I mean, can I just ask everyone to mute, please? Then once I've finished answering, you can unmute and ask any questions, okay? Thank you. Right, okay. So the basics of MRCEM and FRCEM are the same. Okay, just one second. Okay, the basics of MRCEM and FRCEM are the same. The different way what is the similarity, okay? So in MRCEM as well, there are a lot of communication stations. In FRCEM, there are a lot of communication stations. In both of these exams, there are resuscitation stations, ATLS, ALS, APLS. Okay. What is the differences? The first big difference, when you are going for an MRCEM exam, the examiners or the Royal College of Emergency Medicine are expecting the candidates to act or to behave or to take decisions at the level of a registrar or a senior registrar or a specialist in certain parts of the world. Okay. So what is the meaning of a registrar? Registrar is a deputy of the consultant. When the consultant is not around, it's like for example in the night shift, they take charge of the department. So that means they should have some leadership skills at the MRCEM level. They should have some problem-solving skills at the MRCEM levels. Obviously, they must have tested your clinical skills at the primary and intermediate level. But once you come to the FRCEM level, the examiner of the Royal College is expecting the candidates to behave, to make decisions as a consultant. Once you start behaving or making decisions as a consultant, that essentially means that you are the head of the department. You are the head of the department. Once you're the head of the department, the buck stops at you. You are the problem solver. You cannot pass on your problems to anybody else. You have to find solutions then and there. So this is the big difference, the mindset. The MRCEM, the examiners are expecting you to behave like a specialist or registrar. The FRCEM, they are expecting you guys or any candidates to behave as a consultant or make decisions as a consultant. So this is the primary difference. The second big difference between MRCEM and FRCEM. Now, FRCEM might give you a history station or communication station, and they might ask you, please discuss the differential diagnosis with the patient. But at the FRCEM level, they might ask you, please take a history from the patient, discuss the differential diagnosis, discuss the management plan, and further follow up with the patient. So there we go. So there's a bit of a managerial difference at FRCEM level. They're asking you to manage the patient a bit more than they were expecting you to do at the MRCEM level. So this is the second difference. The similarities are quite a lot. The template of communication skills is the same for MRCEM and FRCEM. I would go further ahead and say it's the same for the PLAT as well. But the intensity of the requirements increases gradually once you do PLAT, MRCEM, and FRCEM. Remember, once you're going for the FRCEM level, that is the ultimate exam in emergency medicine. That means that means you expect yourself to be the finished article in emergency medicine. That means you are ready to take on the responsibility of a consultant if, I hope you do, when you do pass the exams, you are ready to take on the role of a consultant. So this is the primary difference. But from the preparation point of view, the basics are still the same. You have to work hard, you have to know what is expected in the communication skills station. You need to know what's expected of you in the resuscitation stations. These are the stations we're going to all discuss step by step. We're going to take small steps. I'm not going to take is one big step, and in the next day I'm going to expect you to go and pass the OSCE exam. That's just unrealistic expectations from you. What I want you guys to do is work with me step by step. Get to know what the examiner wants you to do, what are the basics, and then you build on this. I'm not a firm believer that you can just rock up to a course one week before the exam, attend 2 days or 4 days, absorb all the knowledge, and then expect yourself to go and clear the exam. It just doesn't happen. I've never seen this happen. What I expect you guys to do is take on little bit by bit every day and build on block by block. So by the 48 hours before the exam, you yourself know, you are confident that yes, I am the finished article. I will go and pass the OSCE. There's no one who's going to take away the OSCE from me. I know how to do OSCE. I know the basics. I have full control over me. I have practiced each station 25, 30 times. It's in my autopilot. On the day of the exam, I go outside the station, I see it's a history taking, chest pain. Right. Within all of a second, my autopilot works, I'm ready. Snap. The only thing I need to think of is, what are they asking me in that station? What are the catch in that station? What I'm not thinking about is what questions I need to ask on that station, because I already know. I've practiced that station 25, 30 times. I go in, bang, I start on introduction. What is your main problem? I talk about the chief complaint. I talk about the associated symptoms. I talk about the review of systems. I talk about the past medical history, past surgical history, medication, allergies, travel history, occupation history, social history. I give them a management plan, differential diagnosis. Finished. In the end, I do a couple of catchphrases to cover my back. I will talk about those catchphrases later on. Then last minute I'm thinking, is there anything I can do more? Is there anything I can outperform the other candidates? Have I done enough to pass the exam? Yes, I have. I go on to the next station. I leave that thought, whatever happened in that station, then and there. I do not carry that on further on. This is how good you should be. And by all means, I've seen my friends, my colleagues, my candidates manage to do this. If they can do it, you guys can also do it, okay? So we've talked about differences between MRCEM and FRCEM. Right, I'm just going to ask you guys if somebody has any other questions. Please, yes, please.
Good evening, sir. So my question is, like, if we have 18 different stations, so at the start of every station, are we given a template, like this is a history taking station, this is a resuscitation station, this is a breaking the bad news station? Is it written, like, is it written so that we can focus on that particular thing?
All right.
Or do we just have to we just have to decide ourselves after getting into one station, whether I should ask the history or this is a resuscitation one, which. So do we get templates while doing that, or no, we have to do it on our own?
Right, okay, excellent, lovely. Another great questions. I feel really, I feel overwhelmed that I've got very good candidates sitting there with asking the right questions, okay? Very sensible question this is, right? How do we know what station this is? Okay, that you're going to find out once you read the whole scenario. Now, your reading skills should be at the top peak. You should go in and read the scenario within 10 seconds, first of all, okay? Go in and just read for 10 seconds. Next 20 seconds, you should spend time on focusing what the details are. Once you read that scenario within the first 10 seconds, you will have an idea. Are they asking me to take a history? Are they asking me to break a bad news? Are they asking, is this a psychiatry station? I mean, is this an examination station? Is this a difficult consultation? Is it a difficult patient I need to deal with? Is it a teaching scenario? Okay, I'll give you an example, right? The scenario we're going to use today, I'm just going to give it out to you guys, okay? 55-year-old Mrs. Smith presented to the emergency department complaining of chest pain. She has past medical history of diabetes and hypertension. Vital signs are blood pressure 122/68 with a heart rate of 60, respiratory rate of 16, and oxygen saturations of 99% on room air. Please take a history and discuss the management plan. So once I read this scenario, within the first 10 seconds, I know, snap, it's a history station. So all of a sudden, the history template comes in front of my eyes. History template comes in. I fit few questions I need to ask. Next 20 seconds, I read again. I focus on the details. Now the details are, in this scenario, is the risk factors. She's a diabetic, she's a hypertensive. The further details are the vital signs. They're saying the blood pressure is normal, respiratory is normal, oxygen saturation is normal. So I know she's comfortable at rest. I mean, she's stable. The third thing I'm going to ask is, what is the giveaway? What is the take home they want to ask me in this? Based on this simple scenario, I know it's a history taking scenario. They're asking me to take a history. Now the examiners in the history station or communication station or any station in OSCE are sitting there with a piece of paper with them, and they have to tick certain boxes, right? In the history station, there are approximately 20 to 25 boxes that they have to tick, okay? And once you go on the OSCE day, that is not the day to find out what the ticks are. You should know those ticks or the boxes before you go into the OSCE station. I mean, a month, 2 months before. So you can focus on practicing your history taking skills. So that becomes second nature. Just like you sit in your car and you drive off. You put the ignition on and you just drive off. You don't think, oh, I need to put my accelerator on, I need to put the brake on. Is it automatic? Is it manual? Do you need to put a clutch on? You don't think, you just drive, okay? What you're focusing on, you're not focusing on driving, you're just focusing on hazards. Is this car going to turn left, right, okay? This is how good you need to be. Once you realize it's a history station, you need to just focus on, you don't have to focus on the ticks. That's autopilot, that's inbuilt, that's fitted in your memory now because you've practiced a lot. What you're focusing on is what are the examiners trying to find out from me in this station? What is the main concern of this patient? How will I make her or him comfortable in this station? What will be my plan? That's all what you're thinking of. Like, I'll give you one more example. The second scenario we're going to do today, okay? I'm just going to read out to you. You are the team leader working in the emergency department involved in the cardiac arrest where a 70-year-old male patient has been brought in by the paramedics in cardiac arrest. Prior to the cardiac arrest, patient complained of central crushing chest pain and he had witnessed cardiac arrest in front of the paramedics who started CPR. Once the patient arrived to the department, you have continued CPR, and after carrying on for 30 minutes, you have declared the patient RIP, rest in peace, okay? Please discuss this with Mr. Smith's daughter who's waiting for you in the consultation room. All right. So, the examiners, the Royal College might make you a very long scenario. There's a reason for that. They want you to, get confused, spend time, waste your 1 minute, okay? That's okay, because that's an exam, right? It's justifiable that they are within their rights to do this, right? This is an exam, right? They're not there to help you, right? The candidates who can read quickly, grasp what they wanted to ask, will win this station, okay? Now, if I read through this scenario, I know all of a sudden in 10 seconds is a Breaking Bad news station, right? Anybody who doesn't understand it's a Breaking Bad news, right? You should all know it's a Breaking Bad news station, right? Once you realize the Breaking Bad news station, that template of Breaking Bad news should come in front of your head, in front of your eyes, automatically, right? Because I expect you guys to have practiced Breaking Bad news at least 20-25 times. You should be so good that if you guys get woken up at 2 o'clock in the morning and somebody says, right, go and discuss this Breaking Bad news with this patient relative. You say, all right, no problem at all, I'll be there. You go there, you have a template, you have 13, 14 points you need to hit on. You go in, you introduce yourself, you ask the identity of the other person, you make them comfortable, you ask them what, I will talk about this later on. You hit those 14 checkpoints. At the end, you're comfortable. I've nailed that station, okay? In the last minute, you're thinking, oh, is there anything I can ask? Can I get an extra point? Can I make them more comfortable? Okay, those are the things you need to get on, okay? Right, I hope that answers the question about how do we know what station it is. With practice and practice a lot, you should be able to understand the main theme. History taking, Breaking Bad news, psychiatry station. Okay, right, I'll give you an example, right? I read a scenario and I know it's a mental health station, right? The first thing that should click in your mind is, I need to do suicidal risk assessment on this patient, okay? That should click in your mind, and then you should then read the question again or the scenario again. Is there anything else the examiner or the college is expecting me to find out? So you should be spending that 30 seconds finding out what they want from you rather than going through the checklist of suicidal risk assessment. That should not be the time, okay? Anyways, so let's move on. I'm sure you guys have a lot of questions. So anybody wants to ask any more questions, then we're going to move on for the further scenario, please.
Good afternoon, sir.
Yeah.
Sir, I wanted to ask which would be the best place to find the correct checklist that the examiners use.
Excellent. Thank you very much. Okay. Okay. Now, there is a myth that every year the checklist changes. Checklist does not change every year. They will modify a few things here and there, But the core structure of the checklist is still the same. The basic principles of the checklist is still the same. I'll explain to you why. Like if it's a history-taking station, right? You have to introduce yourself, right? It should be there in every checklist. You have to introduce yourself. You need to confirm the identity of the person you're talking to, the name, the date of birth. Then you need to ask them, how can I help you? Or some candidates use the phrase, what seems to be the problem? Or the other one is, what brings you to the emergency department? The way you talk, the way you ask that question will make all the difference, right? Now your voice, your tone needs to be soft. It needs to be reassuring. It doesn't need to be harsh. I know there might be candidates who just talk with a very high-pitched voice, but they just have to modify the way they're going to speak up in the exam especially. Because remember, this exam is very important because the examiners and the candidate and the patients are looking at you and assessing you out how good your communication skills stations are. I've already discussed this at the start, how important communication stations are. All right, so you can introduce yourself. You're going to ask the identity of the person you're talking to. You're going to ask one of the three phrases. I prefer asking, what seems to be what brings you to the emergency department, okay? Then the patient's going to give you a chief complaint. For example, I've got chest pain, I've got headache, I've got abdominal pain. Then you need to dig into that chief complaint. A candidate who does not dig into that chief complaint will lose points, right? Like, what is about chest pain? You need